Hi everybody, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. So since Princess Kate was diagnosed with cancer, we've been hearing that she had been undergoing preventative chemotherapy after her surgical procedure. However, the use of this terminology is misleading and inaccurate. Preventative chemotherapy is often used interchangeably with what's called adjuvant therapy in the realm of cancer treatment, even by some physicians. This distinction is important because preventative chemotherapy implies that the treatment is administered to prevent the development of cancer in individuals who do not already have the disease. In reality, adjuvant therapy is given after the primary treatment, such as surgery or another procedure, to reduce the risk of cancer recurrence and is aimed at improving the long-term outcomes for cancer patients who have already undergone initial treatment. Adjuvant therapy is typically used in cases where there is a high risk of the cancer recurring and is used to target and destroy these remaining cancer cells, reducing the chances of the cancer coming back. So there are several types of adjuvant therapy that may be used depending on the type and stage of the cancer, and we'll go through them right now. So chemotherapy is the most common form of adjuvant therapy and involves the use of powerful drugs to kill cancer cells. In addition to chemotherapy, adjuvant therapy may also include radiation therapy, and this involves the use of high-energy radiation in different forms to destroy cancer cells and shrink tumors. Radiation therapy may be used in combination with surgery or chemotherapy or as a standalone treatment, depending on the specific needs of the patient. Another form of adjuvant therapy is hormonal therapy, which is often used in breast and prostate cancer. Hormonal therapy works by blocking the tumor's natural hormones that stimulate the growth of cancer cells. The next thing is targeted therapy, and that's another form of adjuvant therapy that specifically targets cancer cells based on their genetic characteristics. This type of therapy is often used in cancers that have specific genetic mutations that make them more vulnerable to targeted drugs. Finally, there's immunotherapy, and that's also a form of adjuvant therapy that harnesses the body's immune system to fight cancer. This treatment works by boosting the body's natural defenses to recognize and attack cancer cells. So the take-home message is twofold. First, adjuvant therapy plays a crucial role in improving the long-term outcome for cancer patients who have already undergone primary treatment. While the term preventative chemotherapy may be misleading, adjuvant therapy is a vital component of cancer care that helps to reduce the risk of cancer recurrence and improve overall survival rates. Second, you need to make sure that your doctor is impeccable with his choice of words, or her choice of words. If it doesn't sound right, it's not. Don't be afraid to ask questions and press him or her for an answer. After all, it's your life that is at stake. So with that, I hope you learned something today. For more questions or medical guidance, you can go to my website at www.paladinmds.com. And I hope you have a wonderful day, and thank you so much for listening.